mental anxiety. And that about 7 out of every 10 people say their quality of life is affected by their oral health.
And that is why this morning and on this Wellness Wednesday, we are bringing in a dental expert to help boost your smile, because there's a new report that reveals many of us, we think that we're doing okay with our dental hygiene, right? But the truth is, we're not. And it's interesting because I think it goes back to when we were kids and just learning how to brush our teeth.
I know. So Dr. Heather Schneider, our expert, is here. She's sharing some simple tips that we can all learn to take better health, better care of our teeth. I mean, it's throwing me off because right now I'm thinking about my routine and I'm like, I'm doing that wrong.
I don't want her to look so close.
That wrong. I know I'm going to be in trouble.
Did you brush? Did you floss?
Yes. Okay, so tell me the number one thing that you find most people are not doing right.
Well, first, let's talk about why this is important.
Okay.
40% of adults 30 years and over have gum disease. This is a big deal, so obviously we can be doing something better at home, right?
Very true.
90% of those who are 20 to 64 have experienced tooth decay. About 20% of that same age range have untreated tooth decay.
Ooh.
So again, this means we can be doing a better job at home. There's the 2 by 2 by 2 rule.
Oh, okay.
What is
I haven't
that?
heard of this. Yeah, what is it?
I knew this would intrigue you. So you want to see the dentist twice a year. You want to brush twice a day, and you want to brush for 2 minutes.
Oh.
And that 2-minute brushing is not arbitrary, it's science-based. 45 seconds and less, you're missing 40% of plaque, so this is a big deal. And it's not just getting in there and scrubbing, but it's being mindful of what you're doing so that you're getting all surfaces of the teeth. Because
Okay, and this is what I need to know, because I've got my kids, we finally have upgraded to the electric toothbrush.
Yeah.
But I've heard that you don't like brush like we all did growing up.
Right.
You almost like drag? What is
So,
it? What
yeah,
is-
How do we do it?
It's, first of all, you want soft bristles.
Okay.
And these are circular, slow motions. And you want to be, and this is so technical, I realize, but
No, I need it.
at a 45-degree angle to your gums.
Okay.
And the reason is there's that little lip under your gums. It's
That's right.
harboring bacteria, and you want to make sure that's what you're eliminating. You're not just looking for fresh breath. You really want to take that bacterial load down.
Okay, can I ask you about something I see viral online right now? Is the tongue scraping?
Yes.
Is that going to be part of the whole kind of like dental health, oral health?
Oh,
or is that just for
absolutely.
fresh breath?
No, no, no. This is absolutely vital. Again, this is taking bacterial load down. The tongue is a very spongy, big surface, right? It holds a lot of bacteria. So scraping that off is important. As a matter of fact, it makes food taste better too. So
Really?
My Diet Coke will be all in the world. Okay, there is also, I feel like, a push for the water picks.
Yes.
Tell me the difference of that versus what we typically do, which is just like kind of getting in there with the floss.
traditional
Which one
floss.
do you
Yeah.
prefer?
Yeah.
you know, as a dentist, I'm going to say any flossing is good flossing, right? But a water pick is nice because you can get in the shower, do it in there, water gets everywhere, you're not making a mess. You can even put mouthwash in the reservoir. So it's
Really?
yeah,
Oh my God.
it's got a lot of benefits. It works really well for those who have braces as well.
But does it have the same effect as just as flossing?
You know, it does. The American Dental Association is not going to recommend one over the other. Again, some form of flossing is better than nothing at all. So water pick is sort of leading the charge right now.
Does it matter which one we do first? Do you recommend like flossing first, then brushing, or brushing, then flossing?
That's a good question. I would say floss first and then brush. Get the gunk out from between your teeth where you can't reach with the toothbrush, and then get in there and do the rest of the work with your brush.
Tell me a little bit more about the brushes that we should be investing in, because I feel like there are so many options when it comes to electric toothbrushes. Or should we not go that way? What do you think?
Consider the size of your mouth. Consider the age of the person using the brush. Children don't have that dexterity, and maybe it would be helpful for them to have an electronic toothbrush. Adults can benefit from an electronic toothbrush too. You just want to make sure that you're using something that you can get all the way into the back of the mouth with. You want to get to the back side of those back teeth. A lot of cavities happen there that people, are missing because they're not brushing back there.
I'm well aware.
Right. We all have like nightmare stories.
They are.
Okay, so I have a 5-month-old at home. So in the next few months or so, he's going to start popping those two, little teeth. What are some good habits I can get him into now with those first little, few months?
It's the tell, show, do. It's making it exciting. It's saying, hey, just starting to talk about the importance of your mouth and how it's connected to the body. Did you know when your mouth is healthy, your body body is healthy. And then you show them, this is how mommy brushes. And then you show them, this is how mommy helps you brush. Now you show me, and you work together. And as a team, you're just forming this great memory and this understanding of its importance. And then you early expose them to their dentist as well. So
True.
Okay,
Take 'em
before
into
you
the
head out, tell us about the Delta Dental of Arizona free under 3. What's that?
So we believe in overall healthcare, and it starts in the mouth, right? Oral systemic relationship is a big deal. So
Yes.
free under 3 means that we will include your 3 and under child on your plan at no additional charge.
Oh, that's great, because it sets them up for life, really. And that's the whole point of making it just healthier forever. Dr. Heather Schneider, thank you so much for being here. I feel like we really learned something. Tomorrow, Em and I are going to be like, yo, my breath is the freshest it's ever been.
Right. Finally, Jen, you'll want to talk to us.